Many people over the age of 60 feel reassured when they hear the words, "Your blood pressure is normal." A number like 120 over 80 feels familiar and safe. It is the number many people have been told to aim for their entire adult life. When doctors say it looks fine, and when charts confirm it is within the normal range, it is natural to feel protected. Over time, these normal numbers become a source of comfort. They suggest that everything is under control. They suggest that the heart is healthy and that the risk of serious problems is low. For many people, these numbers become the main way they judge their cardiovascular health. What most people are never told is that blood pressure numbers do not mean the same thing at every age. The same reading that is reassuring at 40 does not always carry the same meaning at 70. This is not because the numbers are wrong. It is because the body changes in ways that numbers alone cannot fully reflect. Blood pressure is often presented as a static measurement, but in reality, it is a dynamic system. It responds constantly to posture, movement, emotions, sleep, stress, digestion, and hormones. In a younger body, these responses are smooth and well controlled. The cardiovascular system adapts quickly and efficiently, keeping pressure within a narrow, stable range. After 60, this control becomes less precise. Blood vessels lose flexibility. The nervous system becomes more reactive. The heart has less reserve to absorb sudden changes. As a result, blood pressure may fluctuate more dramatically throughout the day, even when average readings remain normal. This is where misunderstanding begins. A normal average number can hide instability. It can hide repeated spikes and drops that place stress on blood vessels and the heart. These fluctuations may never be captured during a routine office visit or a single home measurement, yet they can cause damage quietly over time. Many serious cardiovascular events in older adults do not occur because blood pressure was constantly high. They occur because pressure was unstable. Sudden surges, especially during vulnerable times like the morning, can strain blood vessels that are already less resilient. Repeated over months and years, this strain accumulates. This helps explain something that confuses many people: how someone with good blood pressure can still experience a stroke or heart problem. The issue was not the number they saw on the screen. It was the pattern behind it. In this video, we are not going to challenge blood pressure guidelines or create fear around normal readings. We are going to add context. We are going to explain what doctors look at beyond the numbers and why timing, variability, and patterns become more important after 60. Understanding this does not mean you should obsess over every reading. It means you should understand what information a single reading can and cannot provide. Numbers are tools. They are not complete stories. If you are over 60, or if you care for someone who is, this information is especially important. Aging changes how the cardiovascular system responds to stress and recovery. The body becomes less forgiving of repeated strain, even when that strain is brief. By understanding how blood pressure behaves over time, rather than focusing on isolated moments, you gain a clearer picture of risk. You also gain more control over prevention. Many risks associated with blood pressure instability are modifiable when recognized early. This video is designed to give you that understanding calmly and clearly. There is no emergency here. There is no need for panic. There is only information that helps you make better decisions and ask better questions. In the next part of this video, we will talk about one of the most common hidden patterns in older adults: morning blood pressure spikes that disappear later in the day, leaving behind normal-looking averages that feel reassuring but can be misleading. Many people over the age of 60 measure their blood pressure and feel reassured when the numbers look normal. They may check it in the afternoon or early evening, see a reading that falls within the recommended range, and assume that everything is under control. Over time, this routine creates confidence. The numbers appear stable. There is no obvious reason to worry. What most people do not realize is that blood pressure behaves very differently in the morning, especially after 60. The hours immediately after waking are one of the most vulnerable periods for the cardiovascular system. During this time, important changes occur inside the body, even though they are rarely discussed in routine conversations about blood pressure. When you wake up, your body begins a transition from rest to activity. Hormones such as cortisol rise to help you feel alert. The nervous system becomes more active. Blood vessels tighten slightly to raise pressure and deliver blood to the brain. This process is normal and necessary. In younger adults, it happens smoothly and gradually, without placing stress on the heart or blood vessels. After 60, this same process often becomes more abrupt. Blood vessels are less flexible. The nervous system reacts more strongly. The heart has less reserve to absorb sudden changes. As a result, blood pressure can rise quickly in the morning, sometimes reaching levels that would be concerning if they were measured. These morning blood pressure spikes may last minutes or even hours. Then, as the day progresses and the body settles into a more stable rhythm, blood pressure returns to a normal range. When a person measures their blood pressure later in the day, the reading looks reassuring. The spike has already passed, and there is no obvious sign that it occurred. This is why normal average blood pressure numbers can be misleading after 60. An average blends together highs and lows. It smooths out extremes. Two people can have the same average blood pressure, but very different daily patterns. One person may have stable pressure all day. Another may experience sharp spikes in the morning and lower readings later. The average looks the same, but the stress on the cardiovascular system is not. Morning spikes are particularly important because they place sudden strain on blood vessels that are already more fragile due to aging. Arteries become stiffer over time. They do not expand as easily in response to pressure. When pressure rises quickly, the force is transmitted directly to vessel walls. Repeated over months and years, this can accelerate damage to the inner lining of arteries. The brain is especially sensitive to these changes. Sudden increases in blood pressure can stress small blood vessels in the brain, increasing the risk of stroke and contributing to symptoms such as dizziness, headache, or brain fog. These effects may be subtle at first and easy to dismiss, especially if later blood pressure readings look normal. Many people are surprised to learn that a large number of heart attacks and strokes occur in the morning hours. This is not a coincidence. The combination of hormonal changes, increased nervous system activity, and morning blood pressure spikes creates a period of higher risk, particularly in older adults. Morning blood pressure spikes are more likely to occur in people who experience symptoms shortly after waking. Feeling dizzy, anxious, unwell, or unusually fatigued in the morning can be clues that blood pressure is unstable during this time. These symptoms often improve later in the day, reinforcing the belief that nothing is wrong. Doctors who focus on cardiovascular health pay close attention to timing. They ask when symptoms occur, not just what the numbers are. They know that a normal afternoon reading does not erase a stressful morning pattern. This is why some treatment plans focus on morning routines and medication timing rather than simply lowering overall numbers. Understanding morning blood pressure spikes changes how you interpret readings. It encourages you to look beyond single measurements and consider when and how pressure changes. This perspective does not create fear. It creates awareness. Awareness allows for calmer, more effective prevention. The goal after 60 is not to eliminate all fluctuations. Some variation is normal. The goal is to avoid sharp, repeated spikes that place unnecessary strain on the heart, brain, and blood vessels. Recognizing the importance of morning patterns is one of the most effective steps toward that goal. In the next part of this video, we will look at another hidden issue that often goes unnoticed. We will explain how blood pressure variability throughout the day can cause silent damage over time, even when average numbers remain within a normal range. Many people believe that blood pressure becomes dangerous only when the numbers are consistently high. They imagine risk as something obvious and constant, such as a reading that stays elevated throughout the day. Because of this belief, people feel reassured when their blood pressure appears normal most of the time. What is rarely explained, especially to adults over 60, is that how blood pressure changes throughout the day can be just as important as what the average number is. Blood pressure is not meant to stay perfectly steady. It naturally rises and falls in response to posture, movement, stress, emotions, digestion, and sleep. In a healthy and younger cardiovascular system, these changes are smooth and controlled. Blood vessels expand and contract easily. The nervous system adjusts gradually. The heart absorbs these changes without strain. After 60, this flexibility begins to decline. Blood vessels become stiffer and less responsive. The nervous system may react more abruptly to stimuli. The heart has less reserve to buffer sudden shifts in pressure. As a result, blood pressure may rise and fall more sharply than it used to. This pattern is known as increased blood pressure variability. and it is one of the most overlooked cardiovascular risks in older adults. Blood pressure variability means that pressure fluctuates widely instead of remaining relatively stable. A person may have normal readings at rest, but experience sudden spikes during stress, physical activity, emotional reactions, or transitions such as waking up or standing. These spikes may last only minutes and then disappear, leaving behind normal-looking numbers that feel reassuring. The danger of variability lies in repetition. Each sudden rise in pressure places mechanical stress on blood vessel walls. Over time, repeated stress damages the inner lining of arteries, known as the endothelium. This lining plays a crucial role in regulating blood flow, preventing clot formation, and maintaining vessel flexibility. Damage to this lining occurs silently. It does not cause pain, and it does not show up on routine blood pressure measurements. Because the damage is gradual, people often feel well while it is happening. There are no alarms. There is no single moment that signals a problem. Instead, injury accumulates quietly over months and years. This is one reason why blood pressure variability can be more dangerous than consistently mild elevation. Steady high pressure is often detected and treated. Variable pressure can hide behind normal averages while causing ongoing harm. The brain is particularly vulnerable to these fluctuations. Small blood vessels in the brain are sensitive to sudden changes in pressure. Repeated spikes and drops can weaken these vessels, increasing the risk of stroke and contributing to subtle cognitive changes over time. Symptoms, such as dizziness, brain fog, or brief headaches, may appear intermittently, then disappear, making them easy to dismiss. Many people are surprised to learn that research has identified blood pressure variability as an independent risk factor for cardiovascular disease. This means that even when average blood pressure is controlled, high variability can still increase the risk of heart attack, stroke, and vascular damage. Doctors who focus on heart and vascular health pay close attention to this pattern, even if it is not widely discussed in routine care. One challenge with blood pressure variability is that it is difficult to detect without careful observation. A single reading cannot reveal it. Even occasional home measurements may miss it. Variability reveals itself through patterns over time, inconsistent readings, and symptoms that come and go without a clear explanation. People with high variability often describe their blood pressure as unpredictable. Some days it looks fine. Other days it seems unusually high or low. They may feel well at one moment and unwell the next. This inconsistency is often attributed to stress or anxiety, but in many cases, it reflects physiological changes rather than emotional ones. Several factors increase blood pressure variability after 60. Poor sleep, dehydration, irregular medication timing, caffeine sensitivity, and emotional stress all contribute. Chronic conditions such as diabetes, kidney disease, and autonomic nervous system changes also play a role. Importantly, many of these factors are modifiable. Stability becomes more important than perfection after 60. A blood pressure that is slightly higher but stable often places less strain on the cardiovascular system than a pressure that looks normal but fluctuates widely. This perspective changes how we think about risk and prevention. Understanding variability encourages a shift away from focusing solely on numbers. It highlights the importance of routines, timing, hydration, sleep quality, and consistency. These factors help smooth out fluctuations and reduce stress on blood vessels, even when average numbers remain unchanged. In the next part of this video, we will discuss something that often surprises people. We will explain why doctors sometimes become concerned even when blood pressure numbers look normal, and what specific patterns make them look more closely. Many people are surprised when a doctor expresses concern about blood pressure, even though the numbers appear normal. From the patient's perspective, this can feel confusing or even frustrating. The reading looks fine. It matches the guideline charts. There is no obvious reason for alarm. Yet, experienced doctors often look beyond the numbers themselves, especially when caring for adults over the age of 60. Doctors understand something that numbers alone cannot show. Blood pressure is not only about levels. It is about context. It is about timing. It is about how the body responds under different conditions. A single normal reading does not always reflect how the cardiovascular system behaves throughout the day, and it does not always reflect how resilient that system truly is. One reason doctors become concerned despite normal numbers is the presence of symptoms. Symptoms such as dizziness, fatigue, Shortness of breath, chest discomfort, brain fog, or irregular heart sensations suggest that the body may be struggling to maintain stable circulation, even if measurements appear acceptable. Doctors are trained to take symptoms seriously, especially when they occur in patterns rather than isolated moments. Another factor doctors consider is variability. If blood pressure readings fluctuate widely from one measurement to the next, even when most readings fall within a normal range, this raises concern. High variability suggests that the cardiovascular system is under stress and is having difficulty regulating pressure smoothly. This instability can be more damaging over time than slightly elevated but stable pressure. Timing also matters greatly. Doctors pay attention to when readings are taken and when symptoms occur. Normal readings taken later in the day do not rule out significant morning spikes. If symptoms consistently appear in the morning, after standing, or during activity, doctors recognize that these periods may be revealing hidden stress that routine measurements miss. Doctors also consider how quickly blood pressure changes. Rapid rises or drops in pressure are harder on blood vessels than gradual changes. Even if the final number is normal, the path taken to reach that number can matter. Sudden surges place mechanical strain on arteries, especially in older adults whose vessels are less flexible. Medical history plays an important role as well. Doctors interpret blood pressure numbers differently depending on a person's overall risk profile. A normal reading may be reassuring in a healthy 40-year-old, but less reassuring in a 70-year-old with diabetes, kidney disease, heart disease, or a history of stroke. In these cases, doctors are more cautious because the margin for error is smaller. Medication response is another key consideration. Doctors watch for signs that medications may be masking underlying instability. For example, a medication may lower average blood pressure but increase variability or cause excessive drops at certain times of day. When patients report feeling unwell despite good numbers, doctors consider whether medication, timing, or dosage needs adjustment, rather than simply increasing or decreasing treatment. Doctors also pay attention to trends over time. A single normal reading is less informative than a gradual change in how blood pressure behaves. If readings that were once stable become more unpredictable, or if normal numbers are accompanied by increasing symptoms, this signals a shift in cardiovascular health that deserves attention. Importantly, doctors are trained to think preventively. Their concern does not always mean something is wrong right now. It often means they see early signs of strain that could lead to problems later if ignored. This forward-looking approach can feel confusing to patients who expect concern only when something is clearly abnormal. Another reason doctors worry even when numbers look fine is that standard blood pressure measurements do not capture everything. Office readings are brief and artificial. Home readings depend on technique and timing. Neither captures how blood pressure behaves during sleep, stress, or physical exertion unless specifically monitored. Doctors know these limitations and compensate by listening carefully to symptoms and patterns. This approach explains why doctors sometimes recommend additional monitoring even when numbers are normal. Longer-term monitoring can reveal patterns that short measurements miss. It is not about finding a problem. It is about understanding the full picture. Patients sometimes worry that concern means they have failed or done something wrong. This is not the case. Concern reflects attention, not judgment. It reflects an effort to protect long-term health by responding early rather than waiting for a crisis. Understanding why doctors worry can help patients participate more confidently in their care. Sharing symptoms honestly, tracking patterns, and asking questions about timing and variability helps doctors make better decisions. Healthcare works best as a partnership, especially after 60. Normal blood pressure numbers are reassuring, but they are not a guarantee. Doctors know that risk lives in the spaces between numbers, in how the body adapts, recovers, and responds to stress. Paying attention to these subtleties allows intervention when it is most effective and least disruptive. In the next part of this video, we will look at another common reason blood pressure risk is underestimated. We will discuss home blood pressure measurement mistakes that hide real risk and how small errors in technique and timing can create false reassurance. Many people over the age of 60 rely on home blood pressure measurements to monitor their health. Home monitoring is often encouraged because it provides more information than occasional office readings. When done correctly, it can be very helpful. However, when done incorrectly, It can create a false sense of security and hide real cardiovascular risk. One of the most common mistakes is measuring blood pressure at inconsistent times of day. Many people check their blood pressure whenever it is convenient, rather than at consistent times. A reading taken late in the afternoon or evening may look perfectly normal, while morning readings that capture higher risk periods are never recorded. Over time, this habit creates a biased picture that underestimates stress on the cardiovascular system. Another frequent mistake is measuring blood pressure too soon after waking up. The body needs time to stabilize after sleep. Blood pressure, heart rate, and circulation are still adjusting during the first moments of the day. Measuring immediately after getting out of bed can capture unstable values that are difficult to interpret. Some people see high readings and panic. Others ignore the measurement entirely because later readings look fine. Both responses miss the underlying pattern. Posture is another critical factor that is often overlooked. Blood pressure should be measured while seated, with the back supported, feet flat on the floor, and the arms supported at heart level. Many people measure while standing, lying down, or holding the arm up in the air. These positions can significantly alter readings, making them appear lower or higher than they truly are. Over time, poor posture introduces noise into the data, masking real trends. Cuff placement and size are also important. A cuff that is too small or placed incorrectly on the arm can produce artificially high readings. A cuff that is too large may produce lower readings. Many older adults continue using the same cuff for years without checking whether it still fits properly. Changes in weight, muscle mass, or arm circumference can affect accuracy, especially after 60. Talking during measurement is another common issue. Conversation, even casual conversation, activates the nervous system and can raise blood pressure temporarily. Some people talk to family members, watch television, or answer questions while measuring. The resulting readings may not reflect true resting blood pressure, yet they are recorded and trusted. Another mistake involves measuring blood pressure only when feeling unwell. Some people check their blood pressure only when they feel dizzy, anxious, or uncomfortable. Others check only when they feel fine. Both approaches distort the picture. Measuring only during symptoms exaggerates risk. Measuring only during calm moments hides it. Consistency matters more than convenience. Many people also fail to rest before measuring. Blood pressure should be measured after sitting quietly for several minutes. Measuring immediately after walking, climbing stairs, or doing household tasks captures transient elevations rather than resting values. These readings may look concerning in isolation but are meaningless without context. Over time, this inconsistency makes it difficult to recognize true patterns. Recording habits matter as well. Some people remember only the lowest readings. Others remember only the highest. Some do not record readings at all. Without consistent documentation, it becomes impossible to identify trends, variability, or timing-related issues. Memory alone is unreliable, especially when readings fluctuate. Another subtle mistake is over-measuring. Checking blood pressure repeatedly within a short period can activate anxiety and artificially raise readings. People may chase a lower number, measuring again and again until they see one that feels acceptable. This behavior not only distorts data but also increases stress, which itself raises blood pressure. Doctors are aware of these pitfalls. When they review home blood pressure logs, they look not only at numbers, but also at how those numbers were obtained. Inconsistent technique, timing, and recording can explain why normal-looking readings do not match symptoms or clinical findings. Home monitoring works best when it is simple and consistent. Measuring at the same times each day, using proper posture, resting beforehand, and recording readings honestly creates a reliable picture. This approach reveals patterns rather than isolated moments. The goal of home blood pressure monitoring after 60 is not perfection. It is insight. Accurate monitoring helps identify variability, morning spikes, and trends that deserve attention. Inaccurate monitoring hides these patterns and delays appropriate care. Understanding these common mistakes empowers people to improve how they measure and interpret their blood pressure. Small adjustments in technique can dramatically improve the quality of information. Better information leads to better decisions, calmer discussions with healthcare providers, and more effective prevention. In the final part of this video, we will bring everything together. We will summarize what these patterns mean, offer reassurance, and explain how understanding blood pressure beyond the numbers can protect health without creating fear. By now, it should be clear that blood pressure, after the age of 60, is not just about reaching a specific number. It is about understanding how the body behaves over time. Numbers are important, but they are only one part of a much larger picture. When we focus only on averages, we risk missing patterns that quietly shape long-term health. Many people feel uneasy when they first learn that normal blood pressure numbers do not always guarantee safety. That reaction is understandable. Numbers feel concrete. They feel reassuring. Patterns feel vague and harder to grasp. But this discomfort often fades when people realize that understanding patterns actually gives them more control, not less. One of the most important ideas to take away from this video is that risk does not suddenly appear out of nowhere. Serious cardiovascular problems rarely begin with a dramatic event. They usually develop gradually, with small signs appearing long before a crisis occurs. Blood pressure instability, morning spikes, and variability are some of those early signs. Paying attention to these signs does not mean living in fear. It means shifting from a reactive mindset to a preventive one. Prevention after 60 is not about extreme measures. It is about consistency, awareness, and timing. Small changes applied steadily are far more effective than drastic actions taken too late. Another key message is that aging itself is not a failure. Needing more careful monitoring, more thoughtful routines, or more time to recover does not mean something is wrong. It means the body is changing, and change requires adaptation. Healthy aging is not about resisting change. It is about responding to it wisely. Many people believe that taking care of their blood pressure means doing more. More checking, more restrictions, more worry. In reality, good blood pressure management after 60 often means doing things more calmly and more consistently. Regular routines, steady habits, and thoughtful timing create stability, which is what the cardiovascular system needs most. It is also important to remember that you are not expected to manage this alone. Understanding blood pressure patterns allows for better conversations with healthcare providers. When you can describe when symptoms occur, how readings change throughout the day, and what patterns you notice, doctors can make more informed decisions. This partnership leads to better outcomes than relying on isolated numbers. If you have noticed patterns like morning discomfort, inconsistent readings, or symptoms that do not match your numbers, that awareness is valuable. It does not mean something terrible is happening. It means you are paying attention. Attention is the first step toward prevention. Another reassuring point is that many factors influencing blood pressure patterns are modifiable. Hydration, sleep quality, stress management, medication timing, and daily routines all play a role. Improving these areas often smooths out variability and reduces strain on the heart and blood vessels, even without changing average numbers dramatically. Understanding blood pressure beyond the numbers also helps reduce unnecessary anxiety. When people expect numbers to be perfect at all times, every fluctuation feels alarming. When people understand that some variation is normal and that patterns matter more than single readings, they feel calmer and more confident in interpreting their measurements. This perspective also explains why some people with slightly higher but stable blood pressure do well, while others with normal averages experience problems. Stability protects. Instability strains. Recognizing this difference changes how we define success in blood pressure management after 60. As we close this video, it is worth emphasizing that knowledge is not meant to overwhelm you. It is meant to guide you. You do not need to remember every detail. You only need to remember the principle. Numbers matter, but patterns matter more. If this video helped clarify something you have been wondering about, take that clarity as a positive step. Use it to observe, to ask questions, and to make small adjustments over time. Health after 60 is not built in one decision. It is built through many small, thoughtful choices. This channel exists to provide calm, clear explanations about aging, heart health, blood pressure, and circulation. The goal is not fear. The goal is understanding. Understanding leads to better decisions, better conversations, and better long-term outcomes. If you found this video helpful, consider subscribing. Future videos will continue to explore how aging affects the cardiovascular system and what truly matters for staying healthy and independent after 60. In the next video, We will talk about a topic that connects closely to everything discussed here. We will explain why morning routines can quietly raise or lower blood pressure, and how small changes in the first hour of the day can make a meaningful difference over time. Thank you for taking the time to understand your health more deeply. Paying attention today is one of the most powerful ways to protect your future.